Alert. 5 odors that indicate the presence of cancer in your body. The idea that cancer can be detected through odors may seem surprising, but the fact is that there are already advanced studies on this topic. Scientists have discovered that certain types of cancer produce distinct chemical compounds that the body releases into the air. Therefore, today we will reveal 5 odors that may indicate that cancer is silently growing in your body. Knowing them can be crucial for detecting this disease early and saving your life or the life of someone you love. If you like this video, comment with the number 1. If not, comment with the number 0, so I can improve and bring even more relevant content to you. Now, let's get started, beginning with colon cancer, which can remain silent for a long period, but in many cases, leaves noticeable signs such as changes in body odor. Imagine the intestine as an ecosystem full of bacteria that play an essential role in digestion and overall health. When a tumor begins to develop, it alters this delicate balance, promoting the release of chemical compounds with characteristic and unusual odors. These odors can be perceived in different ways. For example, feces may emit a more acidic, stronger, and persistent smell than usual. This happens because the tumor can interfere with food digestion, causing an increase in the release of sulfur-rich gases like hydrogen sulfide, which has a strong and unpleasant smell. Additionally, the presence of blood in the stool, even in small amounts, can bring a characteristic metallic odor similar to iron, which is not typical of normal bodily function. This type of change can be mistaken for simpler issues, such as indigestion or the consumption of specific foods. But it is an important alert. Another characteristic is that intestinal gases may present much stronger or different odors, especially if there is an accumulation of toxins due to partial obstruction of the intestine caused by the tumor. In more advanced cases, even breath can be affected, reflecting an unusual odor that some people describe as similar to rotten food or chemical compounds. This happens because the compound produced in the intestine can be absorbed into the bloodstream and exhaled by the lungs. Understanding these changes is especially important for people over 50 who are in a higher risk group for colon cancer. If you notice persistent and unusual odors, especially when accompanied by other symptoms like changes in bowel habits, unexplained weight loss, or constant fatigue, see a doctor immediately. Another type of cancer that can produce unpleasant odors is liver cancer. The liver is a vital organ responsible for filtering toxins from the blood, metabolizing nutrients, and producing essential substances for the body's functioning. When cancer compromises these functions, the body may manifest chemical changes that result in unusual and persistent odors. One of the most frequently reported odors by people with liver cancer is a characteristic smell of ammonia or rotten fruit on the breath or in sweat. This occurs due to the accumulation of toxins in the body, since the diseased liver cannot process them properly. Additionally, elevated bilirubin levels in the blood, common in cases of liver cancer, can intensify the smell, especially in people with jaundice, which is a yellowing of the skin and eyes. Another aspect is that the altered metabolism of food and the breakdown of proteins by the compromised liver can generate chemical compounds with distinct odors, often described as sweet or unpleasantly acidic. These odors may be more noticeable on the breath, even after brushing or using mouthwash, and in sweat, which can become more intense and abnormal. If these changes in body or oral odor are accompanied by other symptoms, such as extreme fatigue, unexplained weight loss, abdominal swelling, or pain in the upper right region of the abdomen, it is essential to seek immediate medical evaluation. Detecting liver cancer in its early stages is crucial for increasing the chances of effective treatment. Lung cancer. The third type of cancer that can cause strange odors is lung cancer. Although the main focus of this disease is the lungs, which play a crucial role in gas exchange in the body, the impact of cancer can alter the composition of exhaled air, generating noticeable and unusual odors. People with lung cancer report, in some cases, breath with an acidic, chemical smell, or even similar to decaying meat. This occurs because the tumor in the lungs can produce specific chemical compounds, such as volatile organic compounds, which are released directly into the exhaled air. These substances have distinct and often unpleasant odors. Additionally, the presence of secondary infections in the lungs, common in cancer cases, can intensify odors, causing foul and persistent breath. Another important aspect is the increase of compounds like hydrogen sulfide, a gas that may be released during breathing in people with advanced lung damage. This gas, responsible for sulfur-like or rotten egg smell, can be an indirect sign that lung tissue is being affected. The accumulation of toxins in the blood, resulting from the body's reduced efficiency in oxygenating and eliminating waste, can also contribute to abnormal odors exhaled through breathing. These changes should not be ignored, especially in individuals who belong to high-risk groups. Risk groups in lung cancer. People such as smokers or those with prolonged exposure to environmental pollutants or toxic chemicals are at higher risk of developing lung cancer. If these unusual odors are accompanied by symptoms like persistent cough, shortness of breath, chest pain, or hoarseness, it is essential to seek medical attention immediately for a detailed evaluation. Detecting lung cancer at early stages can make all the difference in treatment and recovery. Cancer and changes in odor. Leukemia. Did you know that leukemia, a type of cancer that affects the blood and bone marrow, can also cause changes in body or oral odor? Although not widely discussed, these signs are related to the metabolic changes that leukemia causes in the body, especially as cancerous cells interfere with the normal production of blood cells and the elimination of toxins. People with leukemia may present breath with a sweet smell, chemical, or metallic, often described as unusual. This odor may result from the accumulation of toxins in the blood, since the body has difficulty filtering waste and regulating metabolism. An example is elevated levels of uric acid, a metabolic byproduct that, in excess, can contribute to a characteristic odor on the breath or in sweat. Additionally, gum infections, common in leukemia patients due to low immunity, can intensify unpleasant odors, such as the smell of decaying meat. Another important factor is anemia, a condition almost always present in cases of leukemia, which can lead to metallic odor on the breath. This smell is associated with iron in the blood and the breakdown of hemoglobin, a process that occurs on a larger scale when the bone marrow is compromised. Changes in protein metabolism can also release compounds like ketones, which produce a sweet and acidic odor noticeable on the breath, similar to what is observed in people with uncontrolled diabetes. Although subtle, these odors can be a warning sign that something is wrong in the body. If these signs are accompanied by symptoms such as extreme fatigue, recurrent fever, unexplained bruises, or bleeding, it is essential to seek medical advice immediately. Detecting leukemia in its early stages can make the difference between effective treatment and serious complications. Oral cancer and persistent odor. Another cancer that can be identified by odors is oral cancer. While it is natural for mouth to have odors, especially after consuming certain foods or due to poor oral hygiene, cancer in this area can cause striking, persistent, and hard-to-ignore changes. This occurs because the tumor interferes with healthy tissue, causing inflammation, necrosis, and secondary infections that release chemical compounds with distinct and unpleasant odors. One of the most common odors associated with mouth or throat cancer is described as foul or putrid, similar to the smell of decaying meat. The degradation of tissues and the presence of bacteria that proliferate in the environment created by the tumor also contribute to the bad odor. Additionally, the difficulty in healing wounds in the mouth, often caused by cancer, can intensify the smell since these wounds tend to become infected, releasing sulfur compounds and other foul-smelling gases. Another factor is the possibility of metallic or strange smell on the breath, caused by frequent bleeding or the presence of blood and saliva, something common in tumors in this area. Many people describe this smell as similar to iron or something chemically different from what they are used to. Tissue necrosis can also release chemical compounds that are absorbed by saliva or released directly through breathing, causing the odor to persist even after oral hygiene. These signs should not be ignored, especially if accompanied by other symptoms such as difficulty swallowing, persistent pain in the mouth or throat, changes in voice, or the sensation of something stuck in the throat. Each of the 5 types of cancer discussed here presents characteristic odors that, although often ignored or underestimated, may be the key to early detection and effective treatment. Recognizing these signs, in addition to observing other symptoms, is a way to actively take care of your health and act in time. If you notice something different in your body or in someone close to you, don't hesitate to seek medical advice. Detecting these changes early can make all the difference, saving lives and providing a greater chance of recovery. Knowledge is a powerful tool. Use it to protect your health and the health of the people you love. Friends, thank you very much for your attention, and until the next video, may God always bless you.